Hello, Lebur Rohman, Consultant Sports Knee and Joint Replacement Surgeon here. In this video, I'd like to talk to you about a relatively niche topic called chronic exertional compartment syndrome. This condition is quite rare, but happens a lot in very active individuals, in a lot of elite athletes, and I treat a lot of elite athletes with this condition, and probably the only surgeon in the Northeast to treat for this condition. And it essentially is a condition where the pressures within muscles and compartments exceed that are normal and cause compression on the nerve and blood vessels in that area. First of all, every compartment or muscle expands when we exercise, and the lining or the fascial layer around the muscle is able to expand and accommodate this expansion. But in some cases, the lining of the fascia becomes very tight and does not allow the expansion. So this then causes counter compression within the compartment as the muscle is trying to expand, and leads to compression of the blood vessels and nerves. So patients often feel this as an increasing crescendo type pain within their lower legs. They often describe running or exercising for a specific period of time, such as 10 or 15 minutes, and get a cramping, excruciating pain in their lower legs. Can often be accompanied by numbness and tingling and sharp stabbing pains. However, the key feature also is that the symptoms resolve on resting. This condition is often underdiagnosed, and patients often suffer with pain and symptoms and being told that they have shin splints or other more common conditions. And the issue with it probably not being diagnosed accurately, because diagnosing it is quite difficult. Static MRI scans, x-rays can't diagnose this problem. So how do I go about diagnosing this problem? First of all, a thorough clinical history and examination is essential. And following on from this, if there's features of chronic exertional compartment syndrome, I would often do a dynamic MRI scan, which includes the patient having a static MRI, then asked to exercise for about 30 minutes, and then straight back into the MRI scanner to do a post-exercise MRI scan. And this can be very sensitive and show muscle swelling and edema and confirm the compartment syndrome within the leg on the post-exercise MRI scan. In about 80% of cases, this is positive, but however, the MRI scan can still miss the chronic exertional compartment syndrome. And so therefore, the 100% diagnostic form of diagnosing this is compartment pressure monitoring. And so in some cases where it has not been positive, but the patient clinically on an examination presents with this problem, I will then take the patient to theatre and measure the compartment pressures in theatre, where they're awake, a simple painless procedure where their compartment pressures are measured with a needle, and then the patient is asked to exercise in theatre for 30 or 40 minutes or however long they can until symptoms appear, and then the compartments are measured again with a needle, and this gives a definitive pressure measurement of millimeters of mercury within the compartments to allow us to diagnose. So once diagnosed, how do we treat this? This is treated with mini fasciotomies. So probably 2 to 3 incisions of 1.5 to 2 inches are made on either side of the leg on the inner and outer aspect, and that tight fascia is cut. The procedure is quite short, the risks are low, and the recovery is quite quick with structured physiotherapy. So hopefully that gives you an overview of what chronic exertional compartment syndrome is, how it's diagnosed and how it's treated. And if you've had a similar type of problem of having pain after exercise that isn't resolving with physiotherapy and other non-operative measures, there may be something to be considered. Thank you.